Hi, my name is Lucy, and my presentation is on early childhood trauma and the effects that it can have on children as they develop into adulthood. And I also researched the signs that you can see in a child to tell if they're going through a trauma. So, the description of early childhood trauma is identified as events that take place in a child's life wherein they feel intensely threatened. There's also a time frame where trauma can especially affect the child, and it is known as the critical period. This is a time where the brain's plasticity is most greatly dependent on experience or environmental circumstance. This can take place from ages 0 to 6. And so basically what that's saying is during this critical period, the child's brain or development in the brain, so like for example their frontal lobe, is mostly dependent on their environment and the experiences that they have in their environment. So if they are being raised in an abusive home or they're going through a severe trauma, it can significantly affect them, especially in this critical period. And so there are many types of trauma, and all can vary in severity. The types I will address in this presentation are 1, physical and sexual abuse, 2, survival of disaster, natural disaster like earthquakes or tornadoes, 3, neglect, and 4, traumatic grief. So for number 1, for physical abuse, the signs in childhood that you can see are they will likely show aggressive behavior or try to dominate others with their aggressive behavior. And this can be seen in bullying mostly or harassing other students at school. And there could also be physical signs like cuts, bruises, or burns, especially if they're in different stages of healing, because then you can know it's probably happening multiple times. And there's also hypervigilance. So if the child's always on the lookout for danger or distrusting of others, and they'll likely struggle to make friends just because of that distrust that they have. And then long-term effects into adulthood that can take place are that it can lead to development of mental disorders like anxiety or depression. And they might have struggles in academia, like in high school, in late adolescence, or even in college. They could struggle with academics and grades. They might drop a bit or be lower than average. And then they might also have behavioral problems, show criminal behavior, or have suicidal thoughts or attempts. And then for the second part of number 1, sexual abuse, signs in childhood are acting out sexually or using language that they should not know at their age. And so this is a telltale sign because it would be very odd for a child to know those terms and to be aware of them. And from this, you can probably get an idea that something might be going on, and then you can intervene and help them. And then they might also have nightmares or bedwetting. They might engage in self-harm, and they might have abrupt changes in mood and behavior. And the long-term effects into adulthood include post-traumatic stress, development of mental disorders like depression, anxiety, or even eating disorders. They may get sexually transmitted infections if the abuse is occurring in younger adolescents. So yeah, I guess that doesn't really apply to early childhood trauma, but and then also drug and alcohol problems, relationship problems with family, friends, and especially partners. And I would assume that would be because of their post-traumatic stress, and just that intimacy would probably be a bit more uncomfortable for them. And then for number 2, survival of disaster. So natural disasters can cause extreme devastation to communities, and children who survive these with their families may experience the loss of their home, belongings, and maybe even loved ones. Children, when compared with adults, are actually more susceptible to physical injury in a disaster. So for instance, they have thinner skin because it's not as developed. And so debris, they could get, cut easier and, be injured that way. They also breathe more air per pound of their weight. So if they were in a forest fire or house fire, they could possibly breathe in more smoke than an adult would, and that could more severely damage their lungs. And then they are also at greater risk for fluid loss and overheating. And then some statistics on natural disasters. I found that 292 natural disasters happened in 2019, and the number of billion-dollar disasters are trending upwards. So this just kind of goes to show that natural disasters are pretty prevalent, and if children in early childhood suffer a trauma from this, it's very important that they get help they get the help that they need so they can overcome the physical injuries and maybe even the mental injuries or disabilities that may arise from it, just from the trauma or PTSD, or just from the loss of a loved one, even if during the disaster a family member passes. And then number 3, neglect. Neglect is very serious and occurs when the parent fails to nurture, pay proper attention to, provide for, and protect their child. This is attributed to the absence of responsive relationships. So what I kind of gathered from that, or responsive relationships being where the parent is, constantly attending to their child when they cry, or, giving them the food they need when they're hungry, very responsive, like a parent should be. And the next one is many long-term effects from neglect can take place as the child ventures into adulthood, and chronic neglect has shown to even have more developmental repercussions than even overt physical abuse. And these repercussions listed here are development of attention deficits, for example, ADHD or ADD, meaning that the child has trouble concentrating and they kind of have trouble focusing on one thing at a time and having that executive functioning in their frontal lobe working normally. So neglect can also therefore have an effect on the frontal lobe and prefrontal cortex development. And so the child may have a deficit in that attention, being an executive function that the frontal lobe controls. And then the second, poor academic achievements. So drops in grades, lack of motivation, so they're probably not involved in as many extracurricular activities. They could also have cognitive delays, so struggles with memory or mathematics, arithmetic. They could have stunts in physical growth, disruptions in body stress response, and these effects are all pretty serious. And so it just goes to show that it's very important that any child who shows signs of neglect or that is being neglected, you should reach out and help them if they need it, and make sure the child gets the help they need from the proper sources. And then number 4, traumatic grief. Traumatic grief is where the child loses a loved one, usually a parent, at a young age, where the cause of death is particularly more traumatic and unexpected, most likely through violence or an accident, like a car accident or house fire or other thing like that. So the effects that it can have on a child are inability to recall any positive memories with the person, and it makes it harder for the child to continue with normal, healthy development. And any thoughts of the person, even happy ones, can lead to negative images, avoidance and numbing, so child may not act upset or as if they are grieving. And then they could also have physical or emotional symptoms of increased arousal, meaning irritability, anger, trouble concentrating or sleeping, drop in grades, stomach aches, headaches, increased vigilance, or fear of safety of oneself or others. So also with traumatic grief, it's very important that the child can get therapy and talk through the death of their loved one and be able to express their feelings so they won't have those physical or emotional symptoms affecting them as much. So basically, how to help a child experiencing trauma, mostly just, trauma-focused cognitive behavioral therapy is very helpful, and child and family traumatic stress intervention. So for the family as well, it kind of brings them all in so they can all work through it together. And just make and help the child to feel safe, maintain routines, encourage child to share their feelings, and give child extra support at bedtime. Early childhood trauma is very serious and can have severe effects on the child's development into later life. It is crucial that we as a society make a strong and unified effort to help children who may experience things like this and provide them with the help that they need. With the sources that I used for my research. And that is my presentation. Thank you for watching.